All right, Montoya, check for a pulse, please.
No pulse. Stunning compression.
All right, thank you.
Work around you, okay?
Dan, you're going to be my clinical decision maker, okay? Start time's going to be 10:36, Dan. Denny, you're going to be my runner, clean runner. If you could just set up all of our equipment.
Denny, I need a bag drop mask, please. Bag drop mask. Thank you.
Denny, can you start him with an oral airway as well? Here you go. Good job, Montoya.
Dan, I can take over bagging. Okay.
All right, Brian, if you could take over bagging so Dan can get freed up. Rob, just to let you know, Dan is going to be our clinical decision maker. You're going to be assisting him.
Okay. Rob, can you get a line started for me, please? Yes, sir.
Gentlemen, we're at 1 minute.
1 minute, okay. All right, dropping an OPA. Denny, in your time, can you see if you can find a history of this patient for us, please? Will do.
Stidham,
Yes, sir.
at the 2 minute mark, you're going to be taking over compressions for Montoya, okay?
Yes, sir.
30 seconds. Suction next to you, Brian. "15 seconds to pulse check. Please pre-charge.
Pre-charge. Pre-charging.
5, 4, 3, 2, 1. Pulse check.
Pulse and rhythm check. No pulse. Asystole.
Continue CPR. All right, Montoya, you're going to get the backboard ready. Dan, if you could let me know when an IO is established.
Yes, sir. Rob's working on that now. Robert, you got
Brian, here's your filter for your. I is established. Can I please have a bag of ringers and an epinephrine, please, Denny?
10:39 IO is established. Please mark it in the monitor.
it is. Okay, can you start that over? Focus on.
1 minute to pulse check.
Epinephrine is in. Please mark epinephrine in the monitor.
Plus.
Dan, just double checking. Are we doing 4 minutes on the epi?
That's correct.
All right, I'll give you. I'll let you know when it's time.
What do you want to? Do you want to give fluids or? Okay. We're going to start a fluid bolus at this time.
All right, 30 seconds to pulse check. Stidham, on this pulse check, you're going to rotate to the head. Brian, you're going to rotate out. Montoya, you're going to put the backboard in and then take over compressions.
Okay.
15 seconds to pulse check. Please pre-charge. 5, 4, 3, 2, 1. Pulse check. Hold.
Asystole.
Continue CPR.
Continue. Stop in the charge.
Just to let you know, Dan, you're 3 minutes away for your next epi.
Denny, can we get another epi ready to go, please? You have it, okay. Also the CPAP mask and strap. Medium-sized mask.
After this pulse check, when we get the Lucas hooked up and ready to go, We need to start working on the 4 leads, and we also need to start working on getting a blood sugar.
Ventilate.
Keep that mask, I gotta run.
Ventilate.
1 minute to pulse check.
Ventilate.
John, how's the bag valve compliance?
I've got good bag compliance.
Good study here to verify.
Ventilate.
After this pulse check, we'll do that.
All right.
Ventilate.
And after this pulse check, you're going to be 1 minute away from your next epi. 30 seconds to pulse check.
Ventilate.
What are you doing, okay?
Ventilate. Ventilate.
15 seconds to pulse check. Please pre-charge.
Charging.
Ventilate.
5 seconds. 4, 3, 2, 1. Pulse check.
Ventilate.
863, I got no pulse.
No pulse.
Continue CPR.
Ventilate.
Jump into charge.
All right. After this, we're going to start getting the 4 leads on, and we're going to get the blood sugar.
One of the great things about what I'm going to talk about, which is hand-heavy, is the fact that we'll be able to download or export the information from the hand-heavy app directly onto the EPCR. So the hand-heavy app has the ability to take in more information than it would be if we just used the LifePak 15 for importing information that happened over the course of the resuscitation. So, with that said, let's start talking about, hey, where did this hand-heavy thing come from? Well, it started out as a pediatric app that provided us information on how to best manage some of our sickest patients. Certainly, we all know how difficult it is to manage a pediatric arrest or a pediatric very sick person. Well, we found that the app can also provide us very valuable information in managing the cardiac arrest patient and the adult. I'm going to show you exactly on the Zello phone how the app works. Some of you are actually fortunate to have the app on your phones. So if you have that, that's good. The best time to practice and get used to this app is on calls that aren't very high priority calls. Get used to using the app, and what I always like to preach is open the app and get it going while you're responding to the call. A lot of the information that you need to start the app is covered in the MDC. With that said, let's talk about the 5 major things that they talk about. One is this app has a metronome. So the metronome is going to set the rate for the compressor. Once the compressors are engaged, it will set them at a rate of 110. So there's no more guessing on whether you're going too fast or too slow. Another thing it does is it calls out ventilations for you. So the app will say, ventilate. Ventilate. So the person who's normally ventilating is our least experienced person, correct? So it seems on most of the cardiac arrest that I respond to. I would like to see that person listen to the hand-heavy app versus counting in their head or watching a light flash on the Lucas device. And that way they can focus more on, again, listening to the app as well as focusing on hand position and the volume of the vent that they're giving, okay? So the next thing the app offers us is an opportunity to notify us to pre-charge the monitor. And that brings up something really interesting because, you know, when we turn the metronome on the LifePak 15, it takes away the audible of the monitor charging. So having the hand-heavy tell you to do this, then you can actually hear your monitor charging. That's something that really works for me, and I think that everybody engaged in a resuscitation will actually notice that, hey, the monitor is charging. Right? Another thing that it does is it actually helps us to monitor the times of our epinephrine administration. So on the app, it will tell you at the 3-minute mark, you advise the clinician or the clinical decision maker that it's time to prepare your next epinephrine. Once you've given that epinephrine, then you select that it's been given and it resets for the next 5-minute cycle. Okay? In addition to that, it will also give us a total time of the actual resuscitation. So from start to finish, it will monitor times, it monitors ventilations, it monitors medication, it monitors any type of equipment that we use, it monitors drip rates, and it monitors electricity. If at any time we deliver a shock, then we can add that to our documentation in a drop-down menu. Yes.
All right, question. After a call, the Lucas manual says to replace the suction cup as a disposable item. Does the EMS section want providers disinfecting the cup or replace it each time? This is unclear in the field.
I would like to see the cup disinfected each time. There will be times where the cup will have to be replaced. Sometimes when you remove the actual cup, it damages the cup so you don't get that seal that you need, or it may just be worn from multiple uses. So just depending on the amount of usage and your determination after cleaning it, if it's met, the standard to stay in place. So good question. It's just going to depend on the amount of use that the Lucas gets and the situation of the call. Certainly, if there's bodily fluids that are, have encompassed the cup, then I would consider replacing it versus cleaning it. Okay? Thank you for your question. Okay, so moving on, I'd like to show you the app, and one thing that really stands out is when you turn the app on and you hit CPR, the minute we engage the patient, it's going to automatically start out in a 30-2 cycle. We're going to quickly change that to a continuous cycle, and that references or resembles our high-performance CPR, okay? So the first thing I'm going to do is, again, like I said, if possible, as you're moving down the road, touch the new patient app. Okay, it's then going to ask me for an age or weight. I'll just scroll all the way to the bottom, and we'll go with an adult. So we're on the scene now, and we have engaged the patient. We're currently doing CPR. Start CPR. You see it started out at 30-2. I'm going to change that to continuous. So now that we're in continuous, it's going to start counting my 2-minute cycle. During the 2-minute cycle, at 1 minute and 45 seconds, it's going to tell me to charge the monitor. Okay? Charge the monitor, and it's going to change colors here. So you have not only the ability to see what's happening, but you can hear what's happening. I have it turned down low, but I would advise most of you to have the volume turned up high so that everybody engaged in the incident can actually hear what's going on and they know what to expect, whether it be the runner, the clinical decision maker, or anybody else in the room that's providing some type of service. Okay? When we get to that 1 minute and 45, something in addition to hand heavy that I'm really looking for from an EMS duty officer perspective is preparing for intubation. And that means vigorously deep suctioning your patient during that 15-second period. These are all things that are happening now as we speak, even with our CPR bosses using their own apps. They're just doing it verbally. The hand Tevi is actually doing it for us. Okay? We just got the minute 45. We're telling everybody we're charging the monitor. Deep suctioning is happening. When we hit 2 minutes, it's going to let me know, and then it's going to then prepare us for a 10-second rhythm check. So I hit reset. Gee.
All right, question. How do you log on?
Okay, so how do you log on? The actual hand Tevi app is in the Zello phone, and as soon as your license is already ready to go, as soon as you click on the hand Tevi on the home screen of the Zello phone, it will populate. Okay, so at this point, now I want to start entertaining other things that the app allows me to do, and that's enter in medications, equipment, or any other thing that I'm doing at that point. So I want to document the fact that we now are bagging the patient. So that's very easy. I just come over to equipment, and I scroll here where it says bag valve mask adult. I click on that, successful, and it enters that into my data. Who accounts for ALS? Who has the counts for ALS? Okay, so a lot of times that's the communication that has to take place between the clinical decision maker and the CPR boss. So as a CPR boss, I'm looking to see what's happening with my clinicians. So here we go, we're bagging. I now want to enter another skill set that's been completed. So I go back to equipment, and I want to show that we've started, okay? So we stopped there for a second, and we're back to, we're charging the monitor again, and we're going to go right back to CPR after the monitor is finished charging, and we've checked for a pulse. And at this point, all I'm going to do is reset. And now I'm back to looking for all my other interventions. Okay, so say I want to do an easy IO. Enter that, successful. It's now in my database. So this is time sensitive because I want the time to resemble exactly when it's happening. So real time, this stuff needs to occur. Now I want to give that dose of epinephrine. So I go over here to meds. Click meds, and I want to scroll to epi, 1 to 10,000. Enter, I'm going to do IO, green, and now that gives me my epi time frame. So for just the purposes of this, on our next check, we're going to notice a rhythm change. After the first epi, that's remarkable, but it does happen. Okay, it's a good time for a question.
All right, 3 questions on here. Can you put it on your personal phone, the app?
The app can be put on your personal phone. Unfortunately, we don't have enough licenses for everybody to have one, and that's why it's loaded on every Zello phone.
Okay.
Okay, so we're in our 2 minute, we're charging the monitor at this point. We're waiting, we're deep suctioning if intubation hasn't already occurred. If intubation did occur, then it would be documented here in my equipment. Okay, so we check the rhythm. And now I want to say that we got ROSC in the field. Hit OK. Now this blue arrow here is going to allow me to export and upload the information all regarding the incident. So I'm going to come here and I want to validate that everything is correct, which I do here, and then I submit. This information is now ready to be uploaded onto the EPCR, or the patient care report, and is available for us to go back and review later as a group, along with the code stat documentation.
So I just wanted to actually go through the process of downloading it into our run form. So you would start the call like you would any other call, and let it import the CAD information. And then instead of up here where you would normally download an EKG, you go to Provider Actions, and you'll see this hand-heavy import button right up here at the top. You click on that, and then it contacts the hand-heavy cloud. And you see the one that Chief Lay did, so we'll grab that one. You're going to look for your provider, right? So it's set to filter the last 3 hours, so there shouldn't be a whole big list unless a great deal of people start using hand heavy all of a sudden. When you look, there shouldn't be a whole lot of hand heavy cases in here in the last 3 hours. So you shouldn't have a whole list of people, but you go through and you find yours or whoever was logged in, and download it just like you would anything else. It grabs it from the hand heavy cloud and pulls it in, a lot like it does when it imports an EKG from the Physio cloud. And you can see the two events that we have entered into the hand heavy app. And from here you can just go through. I believe that, so you will have to, I'm surprised it doesn't pick the, oh, you know why? Because I don't have any crew. This would have already been filled in. These two, had I already logged the crew like you guys do when you log in. So you're going to have to just put in the improved or unchanged, and then go along and do that for all the medications. But there's no adenosine button on the life pack. There's no calcium chloride button on the life pack. So you have a lot more flexibility and versatility with regards to the things that you're able to import from hand heavy. But it's very simple, very quick process to get done.